Which are more favourable prognostic factors in patients with schizophrenia compared to poor prognosis factors? Schizophrenia is both a thought and a psychotic disorder. Patients have disorganized thoughts and they're often disconnected from reality. Schizophrenia can have positive symptoms and negative symptoms. Schizophrenia is treated with antipsychotics. Excuse me. So schizophrenia is more likely to affect males, and if it affects them earlier on in age, that's going to lead to a more severe kind of disease. Whereas if females are affected, being female rather than male would have a better prognosis. That is a good prognostic factor. So being a female with schizophrenia, you have better chances compared to a male with schizophrenia. And next, having an acute onset with an underlying trigger is good, contrary to what people might assume. Basically, having an acute onset with a trigger has better prognostic factors because it's something that can be resolved more punctually. Now, developing it later in life is another good prognostic factor. Remember earlier I mentioned that males who develop it in adolescence have a more severe disease course. Then that means that people who develop schizophrenia later, maybe in their 20s or maybe in their late 20s or 30s, they are actually likely to have a better prognosis than those who develop it early. Having more positive symptoms in their disease is another good risk prognostic factor because antipsychotics are more targeted towards treating the positive symptoms of schizophrenia. Okay, and no one else in the family having schizophrenia is another good prognostic factor. And contrary to this, patients who have family history of schizophrenia have a poorer prognosis. Okay, and having shorter outbursts of symptoms is better than a long drawn-out symptoms. Again, this is better because it's more easy to resolve and it's associated with better outcomes for the patient as opposed to patients who have a course of schizophrenia which is a lot more long-lasting. Thank you for listening.